Hey guys, Chad here, aka Needle Daddy. I am a board certified physician assistant, injector, and the founder of Icon Aesthetics and Wellness. In this video, what we want to do is kind of give you a sense of what it's like to come into our clinic and get a lip injection procedure. When it comes to lip injections, there's two types of clients. There's those who are coming for the first time and those who have had it before. So let's talk about those coming for the first time. I know you have a lot of questions, you have concerns. Everybody who comes in for the first time, they always have the same concerns. I don't want to look overdone. I don't want to look like a duck. I don't want to look like a blow-up doll. Well, guess what? We don't want you to look like those things either, and I promise, one session is not enough to get you to that point. A lot of it has to do with the way that we artistically shape the lips as well, which is why it's important to, choose your injector carefully. When you first come into our clinic, what we're going to do is first sit down and kind of talk through your goals. What are you ultimately trying to accomplish in regards to your shape, your size? Once we decide on those things, then what we're going to do is, prepare you for the procedure. We have a couple options to help make your procedure more comfortable in regards to anesthesia, because obviously the lips are a very sensitive area, probably the most sensitive area of any area that we inject with filler. So the second type of client that we get in is those who have had lip injections before. Sometimes you go to a certain place and they will require you to dissolve your previous filler before they will touch you with new filler. Here at Icon, we don't particularly feel that strongly that we have to dissolve your old filler in order to put new filler in place. It really comes down to whether a person is experiencing what we call filler migration, where the filler used to be in the lips and now little by little it's kind of making its way up above the lip and you're starting to round off and lose that kind of crisp, defined edge. In that case, we do recommend that you dissolve some filler. It doesn't have to be the whole thing, but we'll do a dissolving session and then we'll bring you back a week later to do the refill. So when it's time to actually start the procedure, what we're going to do is we're going to anesthetize your lips, which we can do in one of two ways. I would say most of our clients use topical lidocaine numbing cream, which we let sit for about 20 to 25 minutes. It's extremely strong, it's prescription grade, and it makes your lips pretty numb. I will say it's not going to take the pain all the way down to zero, just because the lips are that sensitive. So what we do once we get the lidocaine cleaned off is we'll give you an ice cube to let hold in place, and that's usually enough to take the pain down to where it's very tolerable. The way I often describe it is kind of like when we were teenagers and you get a pimple right on the border of your lip and you go to pop it, kind of stings, makes your eye water just for a second, and then it's over. It's about like that. It's also recommended that you do not come do lip injections right before the onset of your menstrual cycle, because your body will be more sensitive emotionally and physically to the pain. So we do recommend that you come kind of on the back side of your menstrual cycle to have the best possible experience. For those clients who do want to have a zero pain experience, we can also do what's called a block, a nerve block or a dental block, where we flood the area with lidocaine, kind of like they would do at the dentist, and everything goes numb. Your teeth go numb, your lips go numb, the tip of your nose goes numb, and you'll be talking like this for about 3 to 4 hours. You will feel literally nothing. It's pretty extreme, but it is an option for those who do want to have a completely pain-free experience. So in preparation for your procedure, you want to do your best to avoid alcohol and anti-inflammatory medications such as aspirin, Motrin, ibuprofen, Aleve, 48 to 72 hours before you come to get injections, because those things will make your blood more thin, which will increase your risk of bleeding and bruising a little bit more. Even if you don't do those things, your risk of bruising is still, moderate. We can never guarantee that you're not going to have a bruise, which is why we do recommend that you don't get lip injections for 1 to 2 weeks prior to any major events that you have, such as weddings, parties, anything that you would have to look photo ready for. You want to give 1 to 2 weeks to kind of allow complete resolution of all the swelling and the bruising. So by the 4-week mark, everything should be completely healed up and your lips should be looking beautiful and the way that they're going to be looking for the next 6 to 9 months before you decide you want to come back and get more, which you will, and we look forward to seeing you again. So we hope that answers some of your questions about getting lip injections. We want you to feel comfortable with us as Icon Aesthetics and Wellness, so we look forward to seeing you in our office to get some beautiful lips.